6. Total death is 4,352. Now, the impact on the psychological health is erupted. The relationship, we can say the different components related. For example, when COVID-19 outbreak and it is locked down. So totally it is blocked. The role of the media, newspaper and the government of the country, which is going to affect the psychological health of the people. Financial crisis erupted due to the lockdown and social distancing and quarantine. Now, mental health issues during the COVID pandemic which is came, what are they going to affect? Emotional, biological, cognitive, psychological, all these are the affected. But first of all, see the emotional problems include fear, rage, edginess, mood swing, critical, and blaming, frustration, depression, emotional numbness, inability to cope, biological means sleep, impairment, sexual functions, cognitive, the poor concentration, poor memory, inability to make decisions, integrity loss, perceptual distortions, reduced self-esteem, confidence, and denial. Psychological aspect are emotion, outburst, anger, withdrawn, lack of ability or interact with others, reduction, loss of appetite, reduction, loss of libido. So it's also suicidal potential, patients, things that I left due to lack of the shortage. So social media and mental health, the social media, it is not good, they can play the good role. So as soon as COVID-19 emerges to become a trending online, several users, YouTube, WhatsApp, Facebook, Instagram and Twitter started the business to gain popularity and thus purposefully sowed mass confusion and panic. They has increased the panic among the people. This invites a number of overwhelming mental burden in form of anxiety, phobia, panic, depression, obsessive irritabilities, and all these things is developed, created by the media. Healthcare workers, those who are working, they are also frustrated, too much perplexed and mobility worried about COVID-19 symptoms. So this also, that is the role of the media, it is spent short. So what happened when the psychological effect to those who are having the positive or quarantine, those who got it, automatically the anxiety, suffering, panic, loneliness, post-trauma, stress disorder, depression, anxiety, fear, boredom, irritability. The healthcare providers also, they are also fearing. Why it is so? Because they are fully packed from head to the toe with the dresses and they are unable to eat anything. They are also feeling very hot. So they are fear and burden out, guilt, work pressure, fear of infection also maybe. Old people, cognitive declines, difficulties in excessive medicine, anger, fear and depression. So it is turbulent times and compacted by the COVID-19 pandemic. The issues of mental health is not only relevant, but it is crucial. Mental health is more than the presence or absence of a mental illness. It is a crossroad between the emotional, psychological, physical well-being. Many people have faced serious challenge to their mental health along with the health impact of the disease. COVID-19 has led to the self and social isolation, disconnection from the family and friends. Quarantine and lockdown are moment resulting in more people the ever experiencing feeling of helplessness, isolation, grief, anxiety and depression. Demand for the health support services has increased exponentially as a result. So this, after that, the people lockdown, how they are living, I cannot explain that in a short time. These challenges increase the capacity and availability of the support government, local community and civic organizations need to increase the resources directed towards the addressing psychological suffering during the pandemic Thus, many people around the world have responded to the pandemic through technology like volunteerism, the United Nations volunteer, and learning on each other to bridge disconnection and improvement. So this is overall the requirement we have to do, the relevant also. And the last, thankful to the people who have listened to my lecture due to that communication. Light had gone before 5 years after that internet came. It is continue, the disturbance going on. I'm extremely very sorry. And now I want your suggestion, your proposal, your comment. It will be appreciable. Thank you all of you. I try to complete within that frame of time.
Thank you, Javed sir. Now we have our third speaker, Dr. Arnold Hubers from Netherlands. He is a consultant psychologist and psychotherapist at Netherlands, and he is a non-trainer of the solution-focused therapy approach. His course participants include mental health professionals, educators, doctors, nurses, policymakers, directors, team leaders, and managers. He has been teaching this solution-focused approach in Europe, the Caribbean, India, China, South Africa, and South America. He is also a founding member of the Dutch Association of Solution-Focused Practitioners, that is VOPN, founding member of the Academy for Solution-Focused Approaches and Research, ASFAR. So there is a long list of his work and achievements. Now I request Dr. Arnold Huber sir to start your lecture, sir.
Good afternoon to you all from the Netherlands. Am I audible? Can you hear me?
Yes, sir, yes. You are audible, sir. You are audible. Please continue.
Thank you.
Welcome, sir.
I'm trying to show my PowerPoint. Can you see my PowerPoint?
No, still we are not.
Can you see it now?
Yes, sir. Now you are audible. Please start your presentation.
No, not at all.
Can you see my PowerPoint?
Yes, sir.
Yes, sir.
Yes, sir. We are seeing here your presentation.
Can you see it? Oh, good. Good afternoon to you all. Thank you very much to our colleagues from the Department of Psychology of the Mithila University, Bihar, for this e-conference about this important topic, mental health during COVID. Thank you very much for the invite. I'm honored and delighted to speak to you about this important topic. Thank you to Professor Asoke Kumar Sarha from Bangladesh and Professor Javed Alam from Ethiopia for your great speeches. UNESCO, United Nations Educational, Scientific and Cultural Organization, has calculated that worldwide 188 countries have suspended their schools. And so that means that 1.5 billion young people were out of education for quite a long time. Meaning that children and adolescents with mental health needs lacked the access to the resources they usually have through schools. Because school routines are important coping mechanisms for young people with mental health issues. And this is something we as mental health professionals have to be aware of. We also have to be aware of the parental unemployment, the increase of domestic violence, the increase of depressive problems with young people. And my contribution for today is about the fact that we can ask different questions to our clients. We can ask problem-oriented questions, or we can ask solution-oriented questions. When we ask solution-oriented questions, the self-esteem of the client will be increased, the client will be activated, the client's creative thinking will be activated. So this is what my talk is about. This is my workstation in the Netherlands, Europe, a small country in Europe. On top you can see my colleague and friend Jasim Korankot from Kerala, India. So I also have a training center, it's called Solution Center in the Netherlands. We deliver training courses for mental health professionals such as psychiatrists, psychologists, educators. It's my colleague Anna Huijse, and she says, please don't talk about social distancing, but please talk about physical distancing and social solidarity. Alan Francis, psychiatrist from United States, and he says something very important. He says, different psychotherapies get equal results. It's not because of, it's not so important the school or the technique that you use, but it's the humanity of the therapist that helps healing. So not the specific technique, but it's the humanity, it's the human contact you make with your client that is healing. Michael Lambert from United Kingdom, researcher and psychologist, has done this wonderful research about the factors that are accountable for success when you do therapy. And he says that 40% of the success is because of the extra-therapeutic factors, directing towards the client. So it's the client's intelligence, social network, this amount of humor, that is accountable for success. 40% points to extra therapeutic factors of the client. 30% of the success is about patient-therapist relationship. So the click they have, does the client trust the therapist? Does the therapist is he able to create some hope during the conversation? So 30% is about patient-therapist relationship. Only 15% is about the technique that you use, the school that you use, and 15% the sole fact that client goes to see therapist creates some hope and expectancy, and that's 15% accountable for the success. Of course, you have heard about the therapeutic alliance. The alliance is very, very important. So a warm, respectful, caring and genuine therapist who has expectations about the talk, has expectations for the client's successes, generally, statistically generates significant difference in patient outcome. And here's our great poet and author from Bengal, Rabindranath Tagore, with a very comforting quote. He says, "The depth of friendship does not depend on the length of acquaintance." So even when we see our clients for a short amount of time, we can do something. This is my mentor, this is my guru from United States, Steve DeShazer, and he's the co-founder of the solution-focused approach. And that's the approach that I'm teaching about, solution-focused approach. As Steve DeShazer says here, you don't need to know a lot of details about client's problem, because when you ask a lot of details about the problem, you will have problem talk. So you can direct the conversation towards solutions by asking different questions. And now you create solution talk. So when you ask about problems, you create problem talk. When you ask about solutions, possibilities, preferred future of the client, you will create solution talk. And this is my topic for today. As a therapist, we have a choice to ask problem-oriented questions, problem-activating questions, is most common. So most therapists, most psychologists around the world do this. They ask problem-oriented, problem-activating questions, leading to problem talk. So, and we have a choice. We can also ask different questions, and these different questions come from the solution-focused approach from Steve DeShazer. And this is what we call resource-activating questions, leading to solution talk. Can I give you an example? During this lockdown, you can ask your client, what problems do you and your family experience during this lockdown? And this is not a bad question, of course not. But when you look carefully, you see it's a problem-activating question, leading to problem talk, because your client will start talking about the problems they have experienced during this lockdown time. Now, the therapist has a choice. He can also ask about, for instance, resilience. What resilience did you notice in yourself and your family members during this lockdown? So this is a 180 degrees different question, because you ask about resilience. And most probably, This question will lead to solution talk. This is an example. Another example. You ask your client, it seems that you are hiding a lot of your emotions for others all the time. What kind of upbringing did you have? So the assumption here is talking about the kind of upbringing your client has and talking about the emotions he or she is hiding for others is useful. And again, this is common for psychologists, therapists all over the world. Don't forget, this problem-oriented question will lead to problem talk. Therapist has a choice. He can also ask a different question, like, suppose you express yourself slightly better in the next future, in the next few days, or the next few weeks. What difference would that make for you? Now, it's a different question leading to a different conversation. The content and the direction of the conversation with your client will be different. And when you look closely, you see that there are different assumptions, different pre-assumptions. Problem-focused approach, you see that the big assumption is that clients have deficiencies, pathologies. So you need your DSM, the dark side of man, your big book with all the pathologies, and they need to be diagnosed and they need to be treated by an expert. In the solution-focused approach, there is a paradigm shift. There's a shift in, view of the client, your own role as a therapist, as a psychologist. So we say that clients have strengths and solutions that can be identified and built upon in the conversation with the therapist. So there's a 180-degree paradigm shift. It's a big change. A different view of the client, a different view of the role of the therapist, and a different view on language. So again, the therapist has a choice. He can ask problem-oriented questions or solution-focused questions leading to a different conversation. Neuroscience. Let's have a look at our brain, especially the limbic system, our emotional brain. And when we ask problem-oriented questions leading to problem talk, this so-called amygdala hijack might occur. So the limbic system might get overstimulated by negative triggers. Also, it's observed that dopamine and endorphin neurotransmitters decrease. When we ask different questions leading to a different conversation, focusing on successes, even in this difficult lockdown time, you can ask about resilience, you can ask about resources, you can ask about positive exceptions of your client's life. And this reduces stress and anxiety and improves creative thinking. That's the whole idea. Also, when you focus on goals, where do you want to move towards? What do you want in the next few weeks to be different? So when you focus on goals, this increases the dopamine and endorphin levels. Because the toward state, when you talk about what do you want to achieve, what do you want to be different in your life, when you talk about positive exceptions, this increases the amount of dopamine and endorphin neurotransmitters in the brain. Talking about small victories increases the influence of testosterone. Talking about positive emotions, positive affects, increases hope and expectancy. Hope leads to the ability to connect present to a preferred future and activates the limbic system and the hippocampus in a positive way. Positive emotions lead to improvement of the prefrontal cortex, the frontal part of the brain. So it improves the executive functions, the ability to concentrate, and also the toward state, positive expected increase again the dopamine and endorphin levels in the brain, says Frederik Banning, a colleague from the Netherlands, who has done research. So here, just to try, is a resource activating question for you. Do you want to try it? Just take 1 minute and please answer this question. Suppose tomorrow you are working with clients, or the day after tomorrow, next day that you are working with clients. Suppose you have a successful day and you are at your best as a therapist, as a psychologist, or as a psychiatrist. What do clients notice about you? Please answer this question for yourself as a tryout. Suppose you have a successful day working with clients and you are at your best. What do clients notice about you? Thank you very much. Trying to stay within the limit of time. I hope you enjoyed my speech. Any observations, comments, questions?
Of course, we have enjoyed, sir, your speech. Now, I request the participants if you have any questions regarding the lecture given by Dr. Weaver, sir. Please put your questions. If any participants who are online, if you have any questions, then please put forward.
It's very hard to hear you because there's a lot of echo. Maybe you write it down. Can you write your question down?
I think there is no question, sir. So thank you very much. Now I would like to request Dr. Dhruv Kumar, sir, our head of the department, to express a lot of thanks to the eminent speakers. Sir, please.
All right. Thank you.
Hello.
Our respected eminent speakers, Professor Ashok Kumar Saha from Jagannath University, Dhaka, Professor Javed Alam.
Hello.
Anybody have any question?
Hello.
Sir, are you asking any question?
Yes. Hello. Yes.
Sir,
Please.
Sir, you may ask any question to Dr. Arnold Dumas.
So I am not listening clearly. It's not possible to listen clearly.
Dr. Saha sir, please first mute yourself and sir, am I audible sir? Am I audible sir? Saha sir? I am asking Dr. Saha sir.
Respected guest, Professor Ashok Kumar Saha from Jagannath University, Dhaka, Bangladesh, Dr. Javed Alam from Gule University, Ethiopia, and Dr. Arnold Rivers, Director Solution Centers, Netherlands. Sir, it was really a very fruitful session for us. Your study duration has enriched the knowledge of our researchers and our students. You all were spared your valuable times and provide us many important inputs that is more important in the present scenario. I, on the behalf of Department of Psychology, Mithila University, express our heartiest thanks. Thank you very much.
Thank you.
So we have concluded the second session, that is the first technical session. Now it's time for second technical session, and that is the paper presentation. And I think I hope our participants are ready for second technical session of paper presentation. The list that I have also shared in the WhatsApp group. First participants is Miss Ritika Verma. Miss Ritika Verma, are you there?
Good afternoon, sir. Is I'm audible? Hello.
Yes.
Good afternoon, one and all. I am sharing the screen for presentation. I hope my screen is visible. Today my topic of research paper is myths about COVID-19 vaccine, presented by Ritika and Vipul, and co-authors are Dr. V.N. Yadav, Divya, Pavitra, Anu, Preeti. Moving forward, as we all know that we are just about to enter in the third Delta wave of COVID-19, and COVID-19 was proclaimed as public health emergency internationally. From the beginning of current pandemic, we are just attempt to find the cure of this COVID-19. Our scientists, our pharmaceutical companies and researchers, because of their constant hard work, effort, we actually come up with the vaccines and medicines. So with the upcoming of medicines, there was an inflow of miscommunication about coronavirus, how it's originate, its preventive measures, its remedies, and etc. But if I talk about the current scenario, actually we are facing about a big challenge, that is vaccination hesitancy. Nowadays, people are delaying the vaccine shot. They can't give acceptance because of myths that are associated with it. Many studies are done in context of myths regarding vaccine. So one study that was done by Hatmal in 2021. So actually talks about that the participants were very hesitant and anxious before getting the vaccination shot. But later on, everything was fine and reassurance was given. One more research that is done by Kebde in 2020 This research actually talks about various myths that was prevailing about the protection from coronavirus. For example, selecting the food item, hot water, alcohol, etc. So the aim of the present study was to explore the myth about COVID-19 vaccine in India. Over to Vipul.
Now we will discuss about the methods, and here so for the purpose of this current study, total 125 participants have participated, and the age range of the participants were 16 years to 45 years. Data was collected from Delhi NCR via Google Form, and the most important part, proper consent was taken. Next is tools. So under the socio-demographic questionnaire, we have included some personal questions like name, contact number, gender, age, marital status. And next is survey. So a web-based cross-sectional survey study was designed through Google Form. And under the questionnaire part, we have included 40 items in order to assess general awareness related to COVID-19 and it's related to vaccination. And the link of the final survey was distributed among the subjects by means of different media platforms, for example, email, WhatsApp and Facebook. And it was requested to the individuals to forward it to others as well, so that more and more people can participate. Over to you, Mithila.
So as we can see the result table, the survey was divided into two parts, that is general awareness about COVID and second is myths related to COVID vaccination. So as you can see the demographic, the age range of participants was fall between 16 years to 45 years. About 32% of people got their first shot and about 9% of people got their second shot. Table 2 talks about general aware, how much of people aware about COVID-19 and its precautionary measures. For example, result indicates that people are highly aware about isolation centers nearby them when the person needs hospitalization. What is the use of actually oximeter and how to use it? And last is people are very much aware about how to register for vaccination, which is actually a very important point. Table 3 talks about myths about COVID-19 related to COVID-19 vaccine. So there are many myths that is related with vaccine as a result of this research. First myth is donation of blood after vaccination. Importance of both COVID shots. After receiving vaccination, we don't need to wear mask and use sanitizer. It's a myth which is come up in this result table. Different blood group will have different consequences over the body. The impact, the vaccination has impact on human fertility. Myth is also related to miscarriages, abortion. Lactating mother should get vaccination, and it is also related to menstruation, that girls who are on her menstruation cycle will not take vaccination shot. So these all these are the myths that we come up as a result in this survey. At last, participants are very much aware about COVID vaccination and infection, but actually the media is playing a very important role, and it is acting as the connecting agent between government and population, so that the important information can be transmitted. But this second wave make people very scared. They have seen the loss of their loved ones, suffering of others, and scarcity of oxygen cylinders, etc. So this can actually affect their mental health at a great extent. We can say that vaccination is a cure of disease, but surely it reduces the severity of symptoms. And
Ritika, you lost your connection.
So I think there is some issue with Ritika Verma. Almost she has completed. So now let's move on to the next participants. Next participant is Dr. Rita Kumari.
Good afternoon, everyone. I, Dr. Rita Kumari, first of all, extend my sincere regards to our actually Dr. Kumar sir. Due to
Good evening, everybody.
I, Dr. Rita Kumari, first of all, extend my sincere regards to our actually Dr. Kumar sir. Due to his undying effort and disciplinary approach, we are here. I extend my sincere regards to all my respected teachers and organizing committee for giving this opportunity to me to present my paper on mental health during COVID-19 and love to my juniors. As we know, mental health, जैसा कि हम सभी जानते हैं, पिछले 2 सालों से हम सभी मानसिक रूप से इस कोरोना काल में न केवल मेडिकल कॉम्प्लिकेशन से गुजर रहे हैं, बल्कि हम अपने बहुत सारे मेंटल हेल्थ इशूज जैसे कि डिस्ट्रक्शन, एंजाइटी, स्ट्रेस, स्टिग्मा, आइसोलेशन, फियर, सैडनेस, लोनलीनेस जैसे मानसिक समस्याओं से भी गुजर रहे हैं। और ये सारी समस्याएं न केवल एक व्यक्ति के दिन प्रतिदिन की उनकी जो उनकी रोजमर्रा की जिंदगी है उसको प्रभावित कर रही है, बल्कि एक व्यक्ति के मानसिक स्वास्थ्य को भी बहुत ही बुरी तरीके से प्रभावित कर रही है। जैसे जब से ये कोरोना काल शुरू हुआ है, तब से इस दुनिया के हर एक कोने में इसके ऊपर दिन प्रतिदिन नए नए स्टडीज किए जा रहे हैं और उन स्टडीज से हर दिन हमारे सामने एक न्यू डेटा और न्यू फैक्ट्स हमारे सामने आ रहे हैं, जिसके आधार पे जब हम लोगों ने एक सिस्टमैटिक रिव्यू किया उन स्टडीज के आधार पे, तो ये हमारे सामने आया कि जो हमारा जनरल पॉपुलेशन है वो दिन फिजिकल केयर जैसे कि रूटीन मेडिकल चेकअप की बात करवा सकते हैं, हेल्दी खाना खाना, सही तरीके से है ना स्लीपिंग, ये सारी चीज़ें हमारे फिजिकल केयर में आ सकता है। फिजिकली हम अपनी इस तरह से केयर कर सकते हैं। साइकोलॉजिकल केयर की बात करें तो थेरेपी है, काउंसलिंग है, मेडिटेशन है, अपने आप को ज़्यादा से ज़्यादा क्रिएटिव बनाना है, इसके साथ ही ज़्यादा से ज़्यादा अपना समय अपने परिवार, अपने बच्चों के साथ स्पेंड करना है, अपनी हॉबीज़ को ज़्यादा से ज़्यादा जो हॉबीज़ हो अपने आप को एक्सप्लोर करना। फिर अगर हम लोग स्पिरिचुअल है तो स्पिरिचुअल लेवल पे जैसे ऐसे कम्युनिटी से खुद को कनेक्ट करना जो स्पिरिचुअल से जुड़े हुए हैं, अपना ज़्यादा से ज़्यादा समय नेचर के साथ बिताना, ज़्यादा से ज़्यादा समय नेचर के साथ स्पेंड करना, बुक्स पढ़ना। प्रोफेशनल केयर की अगर हम लोग बात करें तो खुद अपना जो लंच ब्रेक है उसका सही इस्तेमाल करना, अपने काम की जगह पे ही छोड़ के घर वापस जाना, अपने हॉलीडेज को एंजॉय करना। तो इस तरीके से ये सारी कुछ हेल्थ केयर है जिसको अपना के हम अपने आप को इस महामारी के दौर में भी मानसिक रूप से स्वस्थ रख सकते हैं। अगर ये सभी हम लोग मानते हैं कि इस कोरोना के कारण हम लोग न केवल शारीरिक रूप से बल्कि मानसिक रूप से भी प्रभावित हुए हैं और इसका शॉर्ट टर्म हो या लॉन्ग टर्म हो, दोनों इफेक्ट हमारे मानसिक स्वास्थ्य पे देखने को मिल रहा है। तो ऐसे में हम लोगों को चाहिए कि जितनी जल्दी हो हम अपने आप को वैक्सीनेटेड करवाएं। मैं सोशल की नहीं फिजिकल डिस्टेंसिंग की बात करती हूँ। अपने एक फिजिकल सोशल गैदरिंग में अपने आप को फिजिकल डिस्टेंसिंग को मेंटेन करें, मास्क को पहने और रेगुलर अपने हैंड वॉश करें। इसके साथ साथ जिससे कि हमारे इन्फेक्टेड होने के चांसेस कम हो जाए। और साथ ही इस फील्ड में जो भी अध्ययन हो रहे हैं हमारे भारत के बाहर के देशों में ज़्यादा इसके ऊपर अध्ययन किए जा रहे हैं। हमारे भारतीय कंटेस्ट में, इंडियन कंटेस्ट में जो है इसके ऊपर अध्ययन की बहुत आवश्यकता है। तो हम लोगों को इसके मेंटल हेल्थ के डिफरेंट एस्पेक्ट के ऊपर अध्ययन करने की आवश्यकता है कि कैसे हम अपने इस कोरोना काल में, इस महामारी के दौर में अपने आप को मानसिक रूप से स्वस्थ रख सकें। इन्हीं बातों के साथ मैं अपनी वाणी को विराम देना चाहूँगी।
Thank you, Mithila, Dr. Mithila Kumari ji. Now we have next participant is Miss Rupam Kumari. Rupam Kumari is from same university, Lalit Narayan University. अच्छा स्कॉलर,
बाकी लोग इसमें नहीं है ना।
हाँ, तो रूपम कुमारी is a scholar of this university, and before Rupam Kumari, Dr. Rita Kumari was presenting. She is also from this university. She has done a master and PhD course. So now, please, Rupam Kumari.
Good afternoon, everyone. I am Rohan, research scholar LNMU Darbhanga. My topic is mental health and well-being during COVID-19. As we all know that the COVID-19 pandemic and resulting economic recession have negatively affected many people's mental health and created new barriers for people already suffering from mental illness and substance use disorders. During the pandemic, about 4 in 10 adults in US and India have reported symptoms of anxiety or depressive disorders. Young adults have experienced a number of pandemic-related consequences, loss of income that will contribute to poor depressive mental health and suicidal thoughts. During this pandemic moment, children are more likely to report symptoms of anxiety or depressive disorders than men with children due to school enclosure and lack of child care. The pandemic has disproportionately affected the health of communities of color. Many essential workers continue to face a number of challenges, including greater risk of contracting the coronavirus than other workers. So they are more likely to report symptoms of anxiety or depressive disorders, 42% versus 30%, and suicidal thoughts 22% versus 8% during the COVID pandemic. Advice such as washing our hands and wearing a mask. Make a personal financial plan. Try to stay in touch with our friends and relatives and loved ones. Talk to our children. Introducing our family and children in our plan for good health is essential. We need to be alert to and ask children what they have heard about.
Technical glitches. We will resume this session in 5 minutes. Be patient and thank you. क्या करें? वहाँ चले? ऑनलाइन करना है? हाँ हाँ। 5 मिनट पूरा वेट करना चाहिए। इसको हटा देते हैं। हटा देते हैं काम का। मेरा चार्जर निकाल लीजिए सारे
काट देंगे तो फिर वो दिक्कत होगा नहीं ना।
रहने दीजिए
लाइव चल रहा है,
रिकॉर्ड होने दीजिए। वो लैपटॉप को रहने दीजिएगा। मेरा फ़ोन आपके पास है ना मनीष सर? मनीष सर हाँ मेरे ही पास है। वो देख के पढ़ रहे थे नहीं आती
फैन का फ्यूज हो
ये हट ही नहीं रहा हमारा।
फिर से ऑन ऑफ कीजिए ना, तो मोबाइल से कीजिए। ऑन ऑफ करें तो उससे कनेक्ट करते हैं, ऑन ऑफ करते हैं।
तो मेरा ये वाला नेटवर्क में कनेक्ट कीजिए ना।
सब डाउन कर
नहीं इसमें कनेक्ट करके देखिए।
Second participant. Now we have second participant.
अर्णव कुमार चौधरी
Mr. Arnav Kumar Chaudhary. Mr. Arnav, are you there? If Arnav Kumar Chaudhary is not available, let's move on. And next participant is Dr. Manoranjan Kumar. Dr. Manoranjan Kumar. Serial number 6. Yes.
इसको बंद कर दें OBS बाकी बंद कर दें रिपीट हो जाता
सर इसको क्या करना था?
मेरा फोन है
आएगा सावन आशीष ये 3 आदमी को रहेगा और कोई नहीं अब क्या करेंगे इसको ऑन कर देंगे भैया को जो है गाड़ी बना देंगे ना तो प्रोजेक्ट लगाने की जरूरत नहीं है गया ऐसा नहीं हो
अपना मिट कनेक्ट कीजिए अपना
ये हैंग हो गया है। ये जो है
के बाद
चाहिए होना अब गया।
और जिसको प्रोजेक्ट करना है वही मोबाइल से करना है प्रोजेक्ट अपने घर से
अपने घर से
यहाँ नहीं करना
यहाँ नहीं काम खत्म हो गया यहाँ का
वहाँ पूरा रूम खाली हो गया देखो तो सामान आ गया मेरा बहुत सारा सामान सब है भाई मेरा 2 लैपटॉप होगा चार्जर आपकी होगा मेरा एक्सटेंशन बोर्ड होगा
काफी ऐसा है चेयर ही ऐसा है सब
वैसा कामी आपकी नहीं
टूट जाएगा वैसे उठा टूट जाएगा
Present and self-isolation can not likely cause a negative impact on
सब आ गया
mental health.
रूम यहाँ खाली हो गया सर
Due to public
to overcome
the COVID-19 pandemic has affected educational system worldwide, leading a near total closure of school, early childhood education care services, universities and colleges. Most government decided to close in that state of COVID-19. As July 2020, approximately 100 million Latin Americans affected with social activity to school closure in response to the pandemic. According to UNICEF, monitoring 23 countries are currently implementing national-wide closure and 40 are implementing local closure. Implementing about 40% of the world student population, 112 countries schools are currently open. The global lockdown of education institute is going to cause major interruption in student learning, disruption in internal assessment, and their cancellation of public assessment for qualification or their replacement by an inferior alternative. My objectives, my paper's objective is aim to narrative review previous articles submitted on mental health and education system effect on COVID-19. Investigate the ability to pre-outbreak SOS level of predict change the psychopathological symptoms effects of children and adolescents. Mainly effect on school learning and skills of students. School is the best public policy tools available in the rise skill, while the school time can fund and can rise social skill and social awareness. From an economic point of view, the primary point of being in school is the increase in the child ability. Even the relatively short time in school does the even the relatively short period in missed school will have consequence for the consequence of the skill growth. But can unfortunately many families really on the public school not only for the education but the necessity like food and child care. With school cancelled, many children are left without proper meals, and parents are forced to take off work in order to care for their younger children. The COVID-19 gives the opportunity for the education system also. More online classes, new learning opportunities. Students who are switch from frontal classes to online classes may find that remote education actually works well for them, and many choose take further education. This switch is an opportunity for the many students to try to remote education and make it more likely that the engage with online class in the future. A student being newly introduced to remote education may opt for taking a further degree online due to the benefit of distance learning. Affordable. Conclusion. There is this pressing need to planning the longitudinal and development studies and implementation evidence. This elaborate plan of action to cater to the psychosocial and mental health need to the vulnerable children and the adolescents during the pandemic, as there is most pandemic. There is a need to eliminate children and adolescents access to mental health support service great towards the providing user and developing health coping mechanism. During the current crisis, for this innovative child and adolescent mental health policy with direct and digital collaborative network of psychologists and pediatricians and community volunteers are deemed necessary. Thank you.
ऐसा कीजिएगा, कोई आदमी टाइप हम बोले तो टाइप कर दीजिएगा हिंदी में.
Thank you, Narayan.
Second participant is Dr. Pushpanjali Singh.
Pushpanjali Singh.
Dr. Pushpanjali Singh.
Yes.
नहीं, उन्होंने मानसिक संतुलन पर बल दिया महोदय, मेंटल बैलेंस की बात किया था और डॉली सिन्हा काउंसिलिंग की बात की थी. मुश्ताक अहमद जो है मिथिलांचल में इस पर कोविड पर स्टडीज करने की बात कही थी. 3 को इम्पोर्टेंट प्लान था. या कहिए तो ऐसा हम लिख कर हाथ से लिख कर भेज दें क्या?
सर मोबाइल से भेजिए,
हैं?
हाथ से लिख के भेजिएगा तो मोबाइल से भेजिएगा सीधे छा वो कॉपी पेस्ट करते हैं तो सब बोल के अब बोलिएगा भी टाइप हो जाएगा सर हिंदी में।
हो जाएगा?
हाँ
कीजिए तो हम कर देते हैं।
इतने सही समझिएगा। हेलो हेलो हाँ सर
Hello. Hello, am I audible?
Yes, madam, you are audible.
Actually, I'm not able to sharing my PPT. So, can I start?
You can share your PPT, madam, if you want. And if you are facing any problem, then you can continue otherwise.
Yes, I'm facing some problem. I'm not able to share my PPT.
Then it's okay. You can present simply.
Okay, thank you. Good afternoon, everyone. Thank you for giving me this opportunity to present here. My topic is the role of participation in sports on personality traits of adolescents. My topic is not externally related to COVID-19 but internally aged. Adolescence is a time of transition as individuals struggle to deal with physical, cognitive and social changes throughout this developmental period. Such change can be stressful and require significant psychological adjustment. The study aimed to find out the relation of participation in sports on the personality traits, emotional intelligence and mental health of the high school students. Setting and design is the study was a quantitative study with a cross-sectional design. Questionnaire were used for data collection purpose. I used method and material like the sample of the present study was consisting 400 adolescent students studying in secondary schools in Patna district in the age range of 11 to 18 years. Psychological assessment were done using socio-demographic and personal data sheet, sports participation scale designed by the researcher and differential personality scale by the Singh et al. 2002. Now results reveal that there is significant difference found between both the groups in context of different dimensions of differential personality scale. Responsibility, masculinity, friendliness, heterosexuality, ego strength and curiosity variables. Now we put on conclusion. The study findings establish that dimensions of differential personality scale like responsibility, masculinity, friendliness, heterosexuality, ego strength and curiosity were also significantly different between adolescents participating in sports and adolescents those not participating in sports. My keywords like that, adolescents participation in sports and personality traits. Some images put now Olympic is held and now thank you so much.
Thank you, Dr. Pushpanjali Singh ji. Now, second participant is Subrato Acharya. Mr. Subrato Acharya. Subrato ji, are you there? If Subrato ji is not there, let's move on to next participant. Miss Alpna Shalini. Alpna Shalini. Miss Alpna Shalini. Yes.
Yes, sir.
You can start, madam.
Hello. Good afternoon, all of you.
all the dignitaries and dear participants. Today is the great day of all participants. And the focal theme of today's
Madam,
international
sorry to interrupt
conference
you. If
on.
possible, please turn your camera on.
Okay. Hello.
Yes.
Hello.
Yes, you are audible.
Hello. Yes. Sir. Today's the focal theme of today's international conference on mental health during COVID-19 pandemic issues and intervention. And the mic that today's conference topic is the impact of COVID-19 pandemic on mental health well-being. Start my sharing. Hello.
You are audible, madam. You are audible.
Okay, sir. I am Dr. Alpna Shalini, Department of Psychology, Narayan College, Darbhanga. Today's my topic is the impact of COVID-19 pandemic on mental health and well-being. COVID-19 pandemic is a global health emergency across the world, which has been shown to pose a great challenges to mental health and well-being. So this pandemic is associated with psychological distress that in many cases would meet the threshold for clinical relevance. Different studies indicate that the COVID-19 pandemic is associated with distress, anxiety, fear of contagion, depression, and insomnia in the general population. The spread of coronavirus has resulted in drastic alteration to billions of individuals' emotional, physical, mental, and social and financial status. So social isolation, anxiety, fear of contagion, uncertainty, chronic stress, and economic difficulties may lead to the development or exacerbation of depression, anxiety, substance use, and other psychiatric disorder in vulnerable population, including individuals with pre-existing psychiatric disorder and people who reside the high COVID-19 prevalence areas. So, there is an urgent need for strategies to support people's mental health, alleviating worries around contracting COVID and supporting mental as well as physical health as the COVID-19 crisis during unfold. Mitigation Mitigation the hazardous effect of COVID-19 on mental health is an international public health priority. To cope with this stressful condition, good mental health and well-being practices like mindfulness, learn breathing exercise, try meditation, limit news consumption to trusted source. Mindfulness use of social media, this generation and kind of others doesn't stigmatization and practice empathy are effective. So, healthy way to cope the stress created from this pandemic situation. Mindfulness is the practice of being aware of all that is going on in our mind and around us without explicitly Mindfulness is the practice of being aware of all that is going in our mind and around us without explicitly
reacting to anything. We live each moment as full and rich. To practice mindfulness, bring all the attention on present, be aware of each passing through the feeling without judgment. Evidence shows that practicing mindfulness in our day-to-day lives can significantly increase our capacity to cope with traumatic events, improve control over our emotional states, and reduce anxiety and stress-related symptoms. Meditation is simple, free, and only takes a few minutes. It can promote relaxation, decrease negative emotion, build a skill to manage stress, and increase tolerance. Mindful meditation involves being aware of our body, breath, and thoughts. There are a number of resources online and offline that will guide on meditation. It is It is important to obtain accurate and timely public health information regarding COVID-19 from such trusted source as the Center for Disease Control and Prevention, World Health Organization, and other official advisory by the respective ministries of health. But too much exposure to media coverage of the virus can lead to increased feeling of fear and anxiety. Most coverage, especially on latest scientific development, is not relevant to our day-to-day practices. Balance the time spent on news and social media with other activities such as such as reading, listening to music, talking to others, or some other activities. The panic and chaos caused by the spread of COVID-19 can lead to stigma against people, places, and communities. Stigma can have negative consequences on the mental health of the affected individuals, generate an environment in mistrust, and also discourage stigmatized individuals from reporting or testing for the disease. We should combat stigma by understanding that the virus does not acknowledge social class, race, ethnicity, or nationality. We should show kindness toward people and communities and prevent information that will promote discrimination and bigotry. Knowledge is power. The more to know about a certain issue, the less fearful may feel. Make sure to assess and believe only the most reliable sources of information for self-protection. Do not follow sensational news or social media posts which may impact our mental state. Do not spread and share any unverified news or information further. Do not keep discussing all the time about who got sick and how. Instead, learn about who got well and recovered. Stick to the known advice, hand hygiene, and keeping a physical distance from others. It is being careful about yourself and also about care others. A common cold is not corona infection. The symptoms of corona have been well described. Follow the etiquettes of sneezing, coughing, avoiding spitting in public places, etc. Thank you. Hello.
Thank you, Ms. Alpna Shalini ji. Sorry. Now we have the next participant is Ritika Verma. Again, Ritika Verma and Deepak Kumar.
Good evening, good afternoon, sir. I'm sharing the screen.
Please, turn your camera. Please turn your camera on, madam.
A very good afternoon to one and all. Today's I'm presenting a research paper titled as Perceived Stress and Coping Styles, a study among different genders by Mithila, and Deepak Kumar. So as we all know that the COVID-19 caused a significant distress around the globe. Apart from physical symptoms, it actually shaken our mental health as well. So, as the COVID-19 announced, there was a new stresses that entered in our life, that is fear and worry about oneself and our loved ones. Physical movement got restricted. We can't go out. We are self-isolated in our homes, and some activities are restricted, and hence there is a radical change in our lifestyle. Experiencing more upset even in life, and people are really finding very difficult to cope up with them. So different genders actually gone through a different hardship. For example, males a fear of let's say job loss. For women, actually a lot of work pressure on them, and there is a less me time. And for LGBTQIA community, there is a stress that or you can say a continuous anxiety that they want to live in a closet and they can't come out while living in a family, because again it's a very risky state for them. And there are growing evidences that men are stressed more as compared to women. So actually I want to explore the perceived stress and coping styles among all three genders, that is male, female and LGBTQIA. After a brief literature review, we both made the hypothesis. Firstly, there would be a significant difference between perceived stress among male, female and LGBTQIA. Second will be there will be a significant difference in the coping of male, female and LGBTQIA. Over to Deepak.
Methodology. For the purpose of present studies, total 60 participants, 20 were male, 20 were female and 20 were LGBTQIA were selecting using purposive sampling. And participants' age ranged from 18 years to 13 years. And data were collected from Delhi NCR. No incentive was provided to participate in this research. Measurements, demographic sheet, perceived stress scale by Cohen, and total 10 items indicate how unpredictable, uncontrollable and overloaded respondents. Cope inventory by Harvard, and two dimensions are problem focused and second is emotion or focused.
So let's talk about results. As our first hypothesis says that there will be a gender difference in a perceived stress scale. So but the ANOVA was applied, and the result was stated that there is no significant difference between gender and perceived scale. After that, gender and subscales of COPE ANOVA was applied, and only at one subscale we found a significant difference, that is on religious coping. And in problem focused and emotional focused dimension of COPE inventory, there was no significant difference we found. We can say that there is no difference between stress level among male, female and LGBTQIA, because everyone lost their routines and work schedule, everyone confined their homes, there was a lack of facilities, lack of physical exercises, and every gender is facing altogether different stressors. And this COVID-19 impacted our result. Hence, we can say that after the first wave of COVID-19, the stress level actually boosted up. So second, on the second subscale of scope inventory on religious scoping, we found a significant difference. So Turkey's HSG test, that is post hoc test, was applied to actually find out in which two group there is a significant difference. So results stated that there is a difference between male and LGBTQIA in religious scoping. We can after that, there is no significant difference found in problem-focused and emotional-focused coping as sub-dimensions of cope inventory, because every stressors for gender was different, and they are using some coping mechanisms to cope over it. For example, the scores was high on religious coping because many people are indulged into meditation practices to calm themselves, and to it is act as a coping mechanisms for them. So the limitations of our study is the sample size was very small. COVID-19 impacted our result because the COVID-19 shoot up the stress level, and the coping, hence the coping mechanisms also are very high. Findings can't be generalized. The data was collected through online mode, and implications can be, this is actually a very small attempt to focus on LGBTQIA community especially, and to uncover their hardships. Secondly, we can do qualitative research on around this topic, so that we can have a very in-depth interview, and so that we can able to study very effectively. So that's all are the references. Thank you so much.
Thank you.
Any questions? You can ask. Thank you.
Okay, so participants, if you have any questions regarding the presentation of Dr. Ritika, please put your question forward. So it seems there is no question, and we have completed the today's list of participants. Now, once again, I call Mr. Subrato Acharya. If you are there and want to present, then please present. Otherwise, we are winding up this session. Subrato Acharya. Mr. Subrato Acharya. Okay, it seems he is not present in the meeting. Or he is available, but there is no response from his end. So now we are concluding this session, and thank you everyone. Thank you very, very much, and see you tomorrow once again at 11 a.m. Thank you.